Welcome to Doctors of the World UK's Video Annual Report 2011. This film will introduce you to members of the team to explain what we've been doing to deliver healthcare to vulnerable people. You'll hear more about our disaster resilience work, which is just one of 500 projects we're running across the world.
In January 2010, Haiti was struck by a devastating earthquake. Doctors of the World was actually working in the country for some 15 years before that, so we were very well placed to react to the emergency situation. In the weeks after the earthquake, our surgical teams carried out 800 operations on average, and in the year after the earthquake, we carried out in the region of over 9,000 medical consultations on a weekly basis. A key part of our work is being sustainable, and we're very proud of the fact that 95% of the staff that worked with us in Haiti in the aftermath of the earthquake were actually Haitians. So this means when Doctors of the World does decide to leave the country, the local people will have the knowledge and skills to carry on the work after we've left. As far as emergency projects go that Doctors of the World has been working on more recently, we've been working with those fleeing from Libya because of the political problems taking place there. We've also been working in Japan following the earthquake and tsunami that struck the country, and our teams again have been providing basic medical care to people who've been made homeless by the disaster there.
Although there's been a great deal of focus on climate change, very little attention has been given to the link between health and climate change. That is why we're so committed to the work we're doing on disaster resilience. Building on the success of our programmes in Madagascar, we're planning a project in Bangladesh.
Bangladesh is one of the most vulnerable countries in the world to climate change. In fact, it's the most vulnerable in terms of flooding and risk of flooding. They've had a history of disasters from Cyclone Isla, Cyclone Sida. Doctors of the World have developed a wide range of experience from our projects in Madagascar, which have been working in similar areas of disaster preparedness and risk reduction. So we're hoping to apply those lessons to Bangladesh and to similar contexts in terms of geography and vulnerability to flooding and cyclones.
Here at home, we're busier than ever helping an increasing number of people unable to access healthcare here on our doorstep.
In the last year, we've had over 1,000 service users who've come to Project London because they've exhausted all their other options and they've tried to access healthcare themselves. But they're still having difficulties. So we regularly have women who come to our clinic because they're pregnant and need antenatal care, but they can't get access to the services. And I think without our service, we'd probably find women delivering at home or ending up in A&E delivering in an emergency situation. We have a clinic in East London, and then we have outreach activities at various venues in London to try and reach the most marginalised. Our activities are mainly staffed by volunteers who give up their time and their energy to help those who are most in need.
In addition to providing care, we are sharing our experience with other charities.
We run access to healthcare workshops for charities and other organisations that are at the front lines of working with vulnerable clients and vulnerable groups. And essentially we improve their knowledge of the healthcare systems and the entitlements and rights of their clients. And then the second part of the workshop focuses on improving their advocacy skills, so sharing some of our experience and equipping them with the tools and the tricks that when they are advocating on behalf of their clients, they can effectively help them into the healthcare system. We also run educational sessions which are primarily aimed at healthcare professionals working at the heart of the NHS, so GPs, also administrative staff, because again they're often at the front lines of making the decisions whether somebody will be able to access healthcare or not. And there's still a lot of misconceptions about what the rules and the regulations are, particularly with quite vulnerable groups who have no fixed abode or uncertain immigration status.
Capacity building is an important part of ensuring sustainability, as is advocacy.
From the beginning, advocacy has always been at the center of all the work we do. Probably the biggest reason for that is because if you don't have advocacy, you don't have sustainability. You can't change anything on a long-term basis. Probably the biggest change that the new government has proposed is to completely reform the NHS. And probably the biggest part of that that concerns us is introducing a much stronger profit motive. A lot of people talk about this in terms of privatization. That's the phrase that's most common. So vulnerable people who already have trouble will have even more trouble under the new NHS reforms. That's something that we're very concerned about and fighting against. The second change that the government has proposed is reopening this question of whether vulnerable migrants, irregular migrants, are accessing primary care. We thought we had won that battle. That's something that's been going on since 2004, and now they want to reopen it again. To us, it's really important that anyone who needs care gets the primary care they need. It's more affordable, and the reality is health conditions only worsen over time. They don't cure themselves. So if you deny someone primary care, they end up in hospital, they end up in A&E, and that doesn't help anyone. From a public health point of view, it's a bad thing. From an economic point of view, it's a bad thing. And from a moral, ethical point of view, it's a bad thing.
Our fundraising supporters ensure we're able to touch the lives of vulnerable people around the world.
Well, there are plenty of ways to support Doctors of the World UK and get involved with the charity. You can cycle our London to Paris bike ride, or if you want, you can run a 5k or 10k. We have guaranteed places for the most popular races in London. If you feel a bit less energetic, maybe you want to shake a bucket for us and help us with collections. Or if you have any other fundraising ideas, just get in contact with the team and we will help you with that.
Thanks to our valued supporters, they've raised vital funds to contribute towards relief efforts around the world, such as after Haiti earthquake and the Pakistan floods, as well as providing long-term medical care to vulnerable communities. This includes here on our doorstep at Project London. Teresa has told you about a number of options of how people can fundraise on our behalf, but people can also give directly to us. So this could be through their trust or foundation, their corporate organisation, or individually. So go to our website, follow the Support Us link to find out more information on how you can do that.